Coming to the third question. Which of the following is most likely to be demonstrated on FDG PET scan in a patient with neuropathological finding pictured below? What I'm seeing here, it's very characteristic of a neurofibrillary tangle, as we know, NFT, because it's flame-shaped and it's intraneuronal, and we know NFTs are primarily intracytoplasmic, and they are made of aggregates of hyperphosphorylated tau proteins. And we know NFTs are quite specific for the diagnosis of Alzheimer's disease. And they're literally asking what will be the FDG PET finding in a patient who's suffering from Alzheimer's disease. Remember, in any dementia, you're going to get hypometabolism or reduced activity of a particular area of the brain, which is actually involved by that particular dementia. You know, Alzheimer's disease is something that's going to involve medial temporal lobe, lateral temporoparietal cortex, precuneus, and posterior cingulate cortex. And that is where you're going to see hypermetabolism in the FDG PET. That's why the right answer for this question is option D. And many people know that medial temporal lobe involvement, especially the entorhinal cortex and hippocampal involvement in Alzheimer's disease, is very common. But very few know that involvement of the posterior cingulate cortex is very specific for the diagnosis of Alzheimer's disease. And let us look at the other options. Option A states hypometabolism in the somatosensory cortex and deep cerebral nuclei is very rare and it's not going to happen in patients with Alzheimer's disease. In fact, even if it happens, it's going to be at the very, very last stages of Alzheimer's disease. So this is not the right answer. Option B states hypermetabolism in the occipital lobes. This is consistent with the diagnosis of dementia with Lewy bodies and not Alzheimer's disease. And option C states hypermetabolism in the precuneus and cuneus with preservation of posterior cingulate cortex metabolism. And this is again not consistent with the diagnosis of Alzheimer's disease because involvement of the posterior cingulate cortex is very common and very specific for the diagnosis of Alzheimer's disease. Sparing does not happen in Alzheimer's disease. In fact, this relative sparing of the posterior cingulate cortex is going to be consistent with the diagnosis of dementia with Lewy bodies rather than Alzheimer's disease. And this involvement of precuneus and cuneus with relative sparing of the posterior cingulate cortex is what we call as cingulate island sign. A very pathognomonic sign in FDG PET for the diagnosis of dementia with Lewy bodies. So the right answer for this question is option D.
Subscribe and press the bell icon so you never miss an update from PrepLadder.